Hello everyone, and welcome back to my channel. I'm Hafiz, a cardiologist based in London, and today I'm going to talk about palpitations, which is a common reason I see patients in clinic. If it's your first time here on my channel, I give tips on how to keep your heart healthy and also explain heart conditions in a way that is easy to understand. If that interests you, then click on the subscribe button and bell icon so you get notified every time I release a video. Palpitations are an awareness of your own heartbeat. Normally, your heart beats steadily in the background and you don't notice it. But when something changes, maybe the rate goes up, the rhythm becomes irregular, or a beat feels unusually strong, suddenly you become aware of it. Patients describe this in many different ways. Some say it feels like a fluttering in the chest. Others describe it as pounding, racing, or thumping. Some say it's like a skip beat followed by a heavy thud. A few even say it feels like a bird is trapped inside their chest, flapping around. So why do these sensations feel so different? It comes down to the heart's rhythm and the force of contraction. For example, an ectopic beat often feels like a pause than a big thump. That's because the heart takes a slightly longer rest, then pumps out a larger volume of blood, which you feel as an extra strong beat. On the other hand, a rapid run of beats feels like the heart is racing or hammering in the chest, often out of the blue. Atrial fibrillation, a common arrhythmia in older adults, is described as an irregular, chaotic pounding, almost like a washing machine spinning unevenly. Palpitations can also come with other sensations like dizziness, breathlessness, chest tightness, or even fainting, depending on how the rhythm affects blood flow. That's why we take the story of how it feels when it happens and what else is going on very seriously. Now, it's important to say that not all palpitations are dangerous. In fact, most aren't. Stress, caffeine, lack of sleep, dehydration, alcohol can make you more aware of your heartbeat or trigger extra beats. Some people notice their heartbeats feel louder or stronger when they lie down, especially on their left side. That's actually really common, and it has a few simple explanations. When you lie flat, more blood flows back to your heart, which makes each heartbeat slightly stronger. At the same time, your heart sits closer to the chest, so you physically feel those beats more clearly, especially if you're on your left side, where the tip of your heart presses a bit closer to your ribs. It also has to do with awareness. When you're lying quietly in bed, there's no noise or distraction, so you naturally tune into what your body's doing. Even normal heartbeats can start to feel intense just because you're noticing them more. And for some people, the change in body position can slightly alter heart rhythm or trigger the occasional extra beat, which makes the sensation even more noticeable. So it's usually not that your heart is racing, it's just that you're lying flat makes you more aware of every beat. Many people have occasional palpitations that are completely harmless, but palpitations can also be a sign of something more significant, which needs careful attention. So how do we figure out what's going on? I always ask patients to describe the sensation in their own words and to tap it out on the table the way their heart feels. That can be surprisingly helpful to distinguish regular from irregular rhythms. Then we usually do an ECG to record the heart's rhythm. The challenge is that palpitations can come and go, so a single ECG might be normal. That's where Holter monitoring comes in. A Holter monitor records your heart rhythm continuously over 24 hours, 48 hours, or sometimes longer. If the palpitations are less frequent, we can use event monitors or even implantable loop recorders that sit under the skin and track the rhythm for months. Blood tests can also be useful to check thyroid function, since an overactive thyroid can cause palpitations. Echocardiography and ultrasound scan of the heart may be done if we suspect an underlying structural problem. When we connect the dots, the patient's description, ECG, or Holter findings, and any underlying medical issues, we can usually explain the palpitations and decide whether treatment is needed. Treatment depends entirely on the cause. If palpitations are due to benign ectopic beats, often reassurance is enough, along with advice on reducing triggers like caffeine, alcohol, and stress. If it's atrial fibrillation, we may need medication to control the rate or rhythm, and sometimes blood thinners to reduce stroke risk. For supraventricular tachycardia, beta blockers can sometimes help. Otherwise, catheter ablation can offer a cure by targeting the abnormal electrical pathway. In rare but serious ventricular arrhythmias, implantable defibrillators may be needed. So, when should you worry about palpitations? Red flags include palpitations accompanied by fainting, severe chest pain, breathlessness, or dizziness. Also, if you have a history of heart disease, or if the palpitations are very frequent and disruptive, it's worth seeking medical advice. On the other hand, if you only notice an occasional flutter after too much coffee, it's usually nothing to worry about. To wrap things up, palpitations can feel like flutters, thumps, skips, or racing beats. They're caused by changes in heart rhythm, and while often harmless, they sometimes signal underlying arrhythmias. The key to understanding them is listening carefully to the patient's description, documenting the rhythm with monitoring, and tailoring management to the cause. If this video helped demystify palpitations, please give it a thumbs up, subscribe for more cardiology insights, and share it with anyone who might find it useful. And if you've had palpitations yourself, let me know in the comments how you would describe them. I would love to hear your experience. Thanks for watching, and I'll see you in the next video.